Hello everyone, welcome to the Research Data Management course from NIHR Global Health Research Center for Non-Communicable Diseases and Environmental Change. This second session of the module is about factors impacting data management. I am Niveditha from the George Institute for Global Health who will be delivering the session. The key session objectives are to be able to identify factors that can impact data management and to identify key elements required for developing a data management plan. We'll be discussing about the context, study procedures, and resource-related factors that can affect data management of a project. It's always quite intimidating to start developing a data management plan from scratch when you're given a project. So we'll be discussing about aspects which can help you to get prepared for developing a data management plan. So let's go discuss about the factors which might impact data management. The first aspect is about the data source. You might want to think what type of data we will be collecting in the project. Most of the times it's primary data, and these data can come from respondents who are either in the hospital or in the community or in certain institutions. Your primary data could be also at the facility level, for example, hospitals. You want to assess an hospital, the facilities within a hospital. Your source could be environment, for example, particulate matters or temperature. Or your primary source can come from a laboratory, which is water salinity or certain blood parameters from the blood sample given by the respondents. Many a times the data can be secondary data, which means they are already collected data and they're also organized. However, it is possible that they may not be ready for analysis, and so you might need some curation. Whenever you're having a secondary data at hand, it's important for you to know at what level of aggregation you are looking at. For example, if you are looking at, you're interested in understanding the literature level of individuals, then you might have a data which is providing information about the literature level of a particular individual, or you might get an aggregate of a proportion of people who are literate in a particular cluster. So data from existing literature, typically as in systematic reviews, could also be a type of data which you might utilize in your research project. The second aspect about data is the data collection. How are you going to collect the data? Where will you collect the information from? Who will be collecting? If you are using a questionnaire, will it be completed by the respondent itself, or will it be interviewer administered? What is the instrument, tool, or the questionnaire which you will use to collect data? So all this information will impact the way you're going to manage your data. Apart from that, you will also want to know for each of the data source, you want to know how will they be organized. And for each of the data source, you will also want to know what will be the requirement for processing. The third aspect is about the data format. So the type of data format, for example, you might have data which are numeric, which are coded categories. Most common varieties are numeric and coded categories. For example, air pollution is a numeric. Whereas if you want to know the particular characteristics of an individual, for example, severity of disease or literacy level, or you want to know about the religion, then these are coded categories. Most commonly, information can also be collected as text. They could be short text or they could be long text. Short texts are typically seen in open-ended questions. And sometimes you might be interested in collecting a narrative, then you end up having a long text. You might get information from images, audio, or video files. So for every type of data set, you might need to know if any of these will be the format which you'll be collecting. The language at the time of data collection is typically the local language. However, when you're entering the data into an electronic system, it's possible you might change the language, and when you're storing, you might change the language to something which is uh, more commonly used in softwares. So typically, you might collect in one language and enter it in English and store it in English. So this might also have impact on the data management. So the fourth aspect is about data volume. The best way to gauge data volume is to know the start and end date of data collection. You might also need to have an estimate of how many subjects you're going to collect data and how much information you're going to collect from each individual. The rate of data collection can also be an important factor. For example, if your data collection period is between January to July, it's possible that you will collect a lot of information in Jan and then in July and in between no data. Or it's possible that every month you have a fixed amount of information or a constant rate of information which is getting accumulated. All these again can impact on the resources you'll need and give a heads up to your data management team so that they are prepared. So in summary, about data, you need to know about the sources, the way you're collecting, the format, and the volume in which the data is going to accrue. Now let's move on to the second factor. This is about consent and permissions. So if you're going to get any data, you might need consent. And if you're going to directly collect from the individuals, your consent could be at the individual level or in cluster studies. In many public health studies, your consent might be at the cluster level. Sometimes you might have to collect both from the individual and the cluster level. So the way you're going to collect your consent, if it's a paper-based consent or an e-consent, will have impact on how you're storing and recording the information. Every data will be collected using a tool or an instrument. So most commonly, you might develop study-specific questionnaires. So if you're going to use already existing questionnaires, you need to be mindful of the copyrights. Even if you have taken permission to use the tool, it is possible that there might be a fee-based access or an open access. Any questionnaire, if you need to know if they are validated to the context in which you're collecting. Sometimes you might need translation of the tools to collect the information. So all this information will be important for you to record or to know beforehand. The third aspect about consent is on permissions, even if you're using a secondary data. So while secondary data, you might get hold of the secondary data, you might need to be mindful that you might have to go back to the participants to get consent to use, or you might have to seek exemption for consent if they are not able to identify the individuals from the secondary data. So the third related aspect is about personal identifying information and sensitive data. What is personal identifying information? Any information in any format, which could be paper or electronic format, or in any other media that can reveal the identity of an individual to whom a particular data belongs to. It might reveal that it could be a direct information or an indirect information, which will allow you to contact the person either in person or online. So similarly, what is sensitive data? Any information that can harm an individual in terms of their reputation, their well-being, or livelihood could be considered as a sensitive data. Let's see some examples. It could be information about health, criminal record, or behaviors. So all these might have can harm the individual. So think about the context in which you are doing your research work and think if you need to collect personal identifier information, are you collecting any personal identifying information and sensitive data? The commonly collected personal identifying informations are full name, phone number, social identity card number, and so on and so forth. It might be a combination of it could be just one information or a combination of multiple information which can lead to identity of an individual. So what about de-identification and anonymization? So in any study, you will collect the data and you will link the data with a unique participant ID. Apart from it, you might also collect your personal identifying information. So the way you have coded the data is linking the unique participant ID and the data set, but you also have a link with the personal identification. So your data is coded, but you still have a link to the personal identifying information. Let us say that you have a personal identifying information, but you have not linked it with the data set and the unique patient ID. So this becomes a de-linked data. And this is what typically you do when you collect, even if you collect personal identifying information, you de-link the data before you send it to a different audience, a different group in your research team. It's not necessarily the same because sometimes you might not even collect a personal identifying information. All you have is a unique participant ID and a data set. And such data are called anonymous data. So you need to be clear what exactly you want to do. Do you want to have a de-linked setup or you want to collect totally an anonymous data set? So the fourth aspect is about mode of collection. Data can be collected in paper or in electronic data capture. If you collect your data in paper, then you will have to anyway transcribe it into an electronic format, which means there is a possibility for you to have another layer of uh, error which can happen during transcription. So you might consider that you want to do a double data entry so that you want to minimize data transcription. Or if you choose to do a single data entry, then it is possible that you might have to do some extra quality control measures to check for data errors during transcription errors. If you want to collect the data in electronic data capture mode, then you will have to have devices such as a tablet or a phone or a computer system. However, you might also have to know if you are going to collect the data directly in an online mode or an offline mode. If you're collecting data in online, the data from the instrument gets backed up in the server synchronously. If you're going to collect in an offline mode, then you might need to synchronize after infrequent time points so that the data is secure in one place and the probability of the data getting lost along with the device is minimized. So it's not about data collection, it's also about data transfer, which you need to be cognizant about. And this for a particular study, you might have just only one mode of data collection, or you might have multiple ways of collecting the data depending upon the nature of the study and where the context where you are doing the study. The next aspect is about data linkages. So what are data linkages? Let's see some examples to understand how it might happen in practice. So the first thing is about, will data of one phase be linked to another phase of the project? So you might collect data in one phase, but then the same individuals you might collect in another phase, and you might want to link both the information. You need to have a plan beforehand, and you have to plan it beforehand so that you don't end up with disappointment. The second aspect is about data from one database can be linked to another database. For an example, let us say that you have socio-demographic information in one database and you have the health information from another database because you're collecting from a different source and you might want to link at some point of time. Another example is where you might have to link all the information of individuals coming from a common cluster. which means you should have an identification of which individuals came from which cluster. Another commonly situation which you might notice is repeated data collection. You might collect the same data at one time point and at multiple time points, and these might be linked by maybe at the individual level or at cluster. For example, if you are doing a prospective study, the same individual is contacted multiple time points and you are collecting the same information. If you're doing a cluster level study, it's possible that you are contacting different individuals but all from the same cluster. And so you need to link the same cluster but with different individuals. So this is an example of a cross-sectional study, serial cross-sectional study. So data linkages is crucial, and you should have um, a clear understanding about how you want to do it in your project. So the next aspect is about data storage. When you're actively collecting your data, you still need to store your data. So where you store your data during the active data collection phase is important. But after you've collected your data, you will take the data from the database and you will take it to a different place for using in a different software. Again, data will be stored for some time. And after the project close out, you're going to archive the data in some other place. So it's very important for you to have a plan as to how and where you're going to store your data at various phases of your data cycle. The type of format for each of the data set is also important. Are you going to store in a CSV format, text format, TXT format, or any particular software such as DTA format, which is a format which data uses, and a Word document or as a Word document? You will also need to know if you'll require data encryption, especially if it is sensitive information or you're planning to transfer your data from one place to another place. You will need to have an idea of how long you need to require to store the data, and is there a need for de-identification when you store the data. So there's a lot of information you should be able to plan ahead about how you want to store your data. The next aspect is about metadata. So imagine you get an Excel sheet or a data set to your email inbox. You don't have any other information. So it doesn't make much sense when you have a data set alone without any other information. So typically, a data set has to be associated with a protocol, with a data collection tool which generated the data, a data dictionary, which typically is how a questionnaire is from a paper form is converted into an electronic format, which gives you information about how each question is named in the database, how each response is coded in the database, and what is the structure of how you are going to get it when you export it from the database. You also will need information about how the data was converted from the raw stage into the version which you got for analysis. And this is called the data processing information. You need the location of the data as well as the format in which the data is stored so that you know which software is required to read the data. So all this information, data about data, is called metadata. So you should have a clear plan as to how you want to do it and for each of the data set and who is responsible for this. The next aspect, which is quite important in terms of clinical studies, is there a need for randomization, blinding, or intervention management as part of data management? It is possible you might want some of the variables to be hidden from any of the project managers. For example, in a blinded study, you want the treatment allocation to be blinded. There might be a requirement for randomization of clusters or individuals into two groups or more than two groups. There might be a requirement where you want to have a log of medication, how you're managing the medication, and all these three information becomes extremely crucial. And this is in fact the first information any data management team will ask about uh, a, a study, because this will impact the way you are going to select the electronic data capture system you will use. Finally, you need to know about the institutional and the funder policies related to data sharing, data retention, and data security. So find out about your institutional policies and assess how these may impact data management. And also think about what measures you need to do to comply to these guidelines. So what are the data management factors to summarize? Data, the consent and permission, participant personal identifying information, sensitive data, mode of data collection, data linkages, data storage, metadata, and information about randomization, blinding, and medication management. Of course, you also need to be aware about the institutional policies with respect to storage, security, and sharing. So before you start developing a data management plan, what do you need? The first thing is a thorough understanding of the protocol, as well as the data collection tools which you'll be using, the project timelines, detailed information about the data management factors which you can implicitly gather from the protocol. And then you need information about licensing, storage, data security, and data retention and sharing policy for the particular project. Once you have the information of these, you can start developing your data management plan. You might wonder, why do we need a data management plan? This really helps you to think about who does what, but apart from that, you also will be able to identify challenges early during the project and develop mitigation strategies. It also helps you to organize all the information in one document so that the data management team, analysis team, and the project coordination team have one place to look at all the information. All projects should not be dependent on individuals, so that if there is a change in the personnel, it's easy to transfer responsibilities, and a data management plan greatly helps to transfer project responsibilities. Finally, it can be a regulatory requirement, especially in clinical trials, and hence they can be audited. Remember one thing, data management plan is a live document and it needs maintenance. It's not something which you write once and you leave it. So to summarize, data management of a project depends on various factors. Familiarity with institutional policies is important, and you need to understand the protocol requirements and gather information about the data management factors before developing a data management plan. Thank you.